Por no dar lata, porque están feas.
No, van a hacer el TikTok video para que salgan tus piezas ahí.
Ajá.
So that way they can help other people too.
La que hiciera, pero te digo que es good.
For a lot of other grandpas that don't want to, they're hiding their feet for the family not to see them.
Actually, that's very common.
Yeah.
I see that a lot, especially with this generation
Mm-hmm.
transitions to another place. Before the husband, I remember that happened even with my grandpa. My grandmother made a lot of his appointments, and when he wasn't going to the doctor, and we were like, why not? And then my mom realized, wait a minute. That stuff actually works pretty good, though. It does give you results.
Yeah.
Yeah.
Are those better or you need bigger ones?
I can work with these, because once I get past this one big toe, I think we'll be okay. Let me see. There we go. Yeah, it's just like getting a little. There we go. Not hurting you, am I?
No.
Okay, let me know if I am. Okay, yeah, I can smooth that from there. We're gonna do as much as we can today. I don't want to do. I'm sorry.
I can see you look do the best. I know how you do it. You're pretty good. I like how you do it. You don't hurt me at all.
Okay.
You be there.
I'm gonna help you the best I can. There's one on your fourth toe on the other foot that I'm really interested in. That's an impressive nail. Okay. Yeah, so I can't wait to get a hold of that one. How long have you been growing these? At least a year.
I think more than that. At least a year you said, right? It's kind of complicated. I'm suffering a lot with that. And nothing I can do by myself. I used to have big scissors and cut them up a long time ago. But lately I cannot find this kind of scissors. And it started growing and growing and growing. And I went to suffering for so long.
Well, I'm glad you came to see me and I could help you out.
Yeah, we appreciate you. Thank you. I like, oh my gosh,
Como
where I
te
took
digan,
them to the pedicure
La
place.
mujer que yo luego que me agarró carne, ¿te acuerdas que te dije? Y luego siente que nada, te está dedicando la pura uña. Y punto de ver, tanto de nada de carne. Que sea, que file.
I'm not pinching any of the meat. There we go. Let's see, there's plenty of good fungal underneath that nail. Ooh, that's impressive. Ooh, is that hurting?
No.
Oh, it came off all the way. And that happens a lot of times. The nail will just, it's so long that it keeps bumping on the shoe over and over again, and it just kind of works its way loose. So when you start trying to trim it, it just peels off. Yeah, clean all that stuff off. Very satisfying. Okay, now, Nat, do you want to mask up so we can? Okay, now let's get started here. Take these nails down a little bit. these on high power, and then I'm going to come back with a different tool and work on them. Piece is going to break off nicely there. Let me go ahead and get it because it's going to bother me if I don't. There it is.
Yeah, like he said, he don't care if he uses the whole nail.
He just wants to.
Yeah, he just whatever needs to be done. If you have to color them all off, he doesn't care.
I'm just going to smooth them down, make them nice and comfortable.
Yes, sir.
The funny part is I really find this is very relaxing and I guess satisfying for me as well. So it's interesting.
So I'm a dental assistant and I'm the same way too. Like whenever I see sometimes a hygienist and I see a lot of patients with a lot of buildup and plaque and like dropping off all that concrete onto their teeth. It's going down the side.
I can't remember what I watched those videos too, and the ear cleaning videos as well. I watched some of those. Oddly enough, I don't watch any foot videos. Maybe that's because that's what I do for work all day, but I don't watch foot videos. There we go.
You mad that?
De todo lo que hizo el niño, si te la ves, tiene pena la voz.
He's happy with your work right here. Whenever we took him to the pedicure, as soon as the lady started touching him, he's like, "Oh, you're hurting me."
Yeah, I'm sure a lot of those places, they try their best, but they just probably don't have the equipment.
Yes, exactly. And I saw that, and like her lady, she tried, but it was really hurting. And I'm like, no, we're not gonna force you like that. It's only one toe. Imagine going through all 10.
Yeah. So I normally see my folks about every 2 months or so. I don't like to just knock the nail beds down to nothing because to me that's doing too much. I think it should be almost like a kind of stage thing where you do some and then you come back and you do a bit more. I think I get better results that way, and I don't want, similar to when you go to the dentist, you don't feel like 10 cavities all at one time. You do a few, then you come back, a few more, come back. I don't want our lovely patient here limping around.
Just tell us when he has to come back and we'll bring him back.
Yeah, we're gonna get a good amount done today. I like to try to, my goal is always about 80-85% with all of my patients in this condition to get a lot of that better. And then if we need a touch up. But the people that take the nails down to nothing, if you ever watch those videos, I'm not a big fan of that. I think it's too much. Now we're not going to treat the fungus because you're a bit older, as you are approaching 90, correct?
Yes.
Yes. This is not something that we would really want to mess with. I always say once you're in your 70s at least, give or take, I'm worried more about your comfort and the function than I am about how it looks.
Oh, man.
And also, I don't want to make you ill prescribing you something that interacts with your other medications.
He doesn't take no medication. The only thing he does is he has an asthma pump, and whenever he needs it, he just uses it.
Gotcha.
I'm allergic to environment.
Seasonal allergies.
My friends, I should be born in this land because I'm allergic to everything they water. I cover my head, I started sneezing. And I was declared by severe asthma, chronic, a Mayo Clinic in Minnesota.
Oh, you went to my clinic.
I was one of the best in the people, but they checked me very well.